Good evening, everyone, and thank you for joining us tonight for our Breast Cancer Now Facebook Live. This is a nurse Q&A. My name is Cassie. I'm one of the clinical nurse specialists here at Breast Cancer Now, and I'm joined by my colleague Louise, who is also a clinical nurse specialist for Breast Cancer Now, and we're here to answer your questions today. So before we get started, just a little bit of housekeeping. Just to say the usual, if you do have questions, please do post them in the comments below. We will answer as many as we can as we go through the session tonight. But if there is anything we don't manage to answer, do check back to the comments because we will answer them in writing for you over the next few days. If tonight's conversation triggers anything for you that you'd like to talk through in more detail, or if you have a question that you don't want to ask live and you want to talk to one of our team, you can call our helpline, which will be open again tomorrow from 9 a.m. So the helpline's open from 9 till 4 on weekdays and 9 till 1 on Saturdays. And the number for that is 0808 800 6000. If you don't want to call, you can also contact us in writing. So we've got our Ask Our Nurse service where you can email or use the web form to contact us and have a written reply. And the details for all of this is going to be in the comments below. So if you'd like to get in touch, please do. So I think that's it for housekeeping today. So Lou, we've not had any pre-questions in today, have we? So quite unusual, probably because it's summer. So just to encourage you, it is a good opportunity. If you've got questions, pop them in the comments. And as I say, we'll get through as many as we can. But we thought while we wait for those to come in, there has been quite a lot of breast cancer news recently, lots of things in social media and on the news. One of those is the updates from Jessie J. So we know that she's been quite vocal about her breast cancer diagnosis and talking about her recent surgery and more recently updates around her recovery, particularly around sort of worrying about not being able to pick up her son after surgery, things around body image. So Louise, do you want to kick us off by just having a talk through that? Because it's something we hear a lot in the helpline, isn't it?
Yeah, no, certainly. And I think it is. We hear sort of sporadically, really, throughout the year of somebody who's sort of got high profile, like Jessie J. And for those that maybe are not familiar who she is, she's a pop singer. But I think it just allows a platform, really, to have some of these conversations that lots of hundreds of women are facing day in, day out. But I suppose it raises awareness of people going through that, and obviously giving permission maybe for those that are family members or friends to get a bit more of an understanding of what it's like for people going through a diagnosis of breast cancer. So as you said, Cassie, I think, she's openly spoken about on her on Instagram recently about sort of finding it really difficult where she's in the recovery from her surgery, and we're not quite sure what surgery she's had, but she's obviously got a young son, and has been told by her treatment team that she's not going to be able to pick him up. And again, we speak to lots of people on our helpline, and I know when I was in practice as a breast care nurse that was one of the biggest sort of challenges for parents, particularly with young children, is you're struggling. It's a really sort of the diagnosis and the emotional impact of that, and then being told that you might not be able to pick up your son or daughter, or sort of hug, or because you feel uncomfortable and things like that. And I suppose some of the reasons, it would be quite good to talk through what some of those reasons as to why they might not be able to do that. So depending on the type of surgery, obviously in those early weeks and months, there's still lots of healing to go on. In the early weeks, absolutely, there might be drains, depending on the type of surgery. So if you've had a mastectomy and a reconstruction, some people may even go home with drains. Some of those people will have those drains taken out before they leave. And for people maybe that are just due to have surgery, the thought of what is a drain, that's usually just if there is sort of excess fluid, and it aids really the recovery, and again, treatment teams. And if you wanted us to talk through that in a bit more detail, do give us a ring. We can talk it through for your individual situation.
And there's also sort of on the website as well, isn't there?
Yeah, absolutely. We've got a booklet, breast reconstruction booklet, and a surgery on our website about different types of surgery. So again, there's information there. Obviously, there's swelling, bruising, and altered sensation that people can feel. And if they've had surgery to the armpit, so lymph nodes under the armpit, again, you need to be sort of you don't want to be carrying anything too heavy or putting any strain on your sort of arm recovery in the immediate sort of post-op phase, so in those weeks and months. If you've had immediate breast reconstruction, so whether that's with your own tissue or with an implant, again, that recovery might be a bit longer, and treatment teams may say, well, that's settling down, that you just need to take some time and no sort of heavy lifting. That's not to say that you can't get back to what you were originally before the surgery, but it may take some weeks and some months depending on the type or the extent of the surgery that you've had. And again, your treatment team have probably spoken to you about that there's arm exercises again that can help with the recovery to just maintain and really get back to that sort of movement that you had before. I suppose the other sort of side that Jessie J has spoken about is the sort of the body image and getting used to scars. And that's what we hear a lot from people on the helpline. It's that sort of, again, depending on the type of surgery or whatever surgery it is, there's going to be scars. But the extent of that and what the new breast, if you've had a mastectomy and a reconstruction, or without reconstruction, or even a lumpectomy, it's an adjustment, and it's a period of time where it is about sort of, people are often will say, I don't want to look at it to begin with, or they may feel a bit fearful of what it's going to look like. And even touching it, we speak to lots of ladies sort of who attend some of our support services that will just say, I'm not quite ready to feel that area. So that can take some time. And I suppose the other thing is that although you might have a pre-assessment and your treatment team will say, well, this is how it's going to feel, I think it's that managing expectations and nobody truly understanding how you're going to feel after that. And maybe if you are sort of younger, as Jessie J is, she's 37, being told that you need to sort of not be able to do that. Maybe you're not doing as much around the house. You might not be able to go back to work as quickly as you anticipated. That can be really frustrating for some people. And even not wanting to accept those offers of help, although, again, I'll often say, if people are offering, absolutely take it up. But it can it can be really hard to accept those offers because it's not what you would normally do.
Yeah, and it could be really different for everybody, can't it? Everybody's sort of reaction and how they feel. And as you say, it's not always how people expect that they're going to feel, and that can come as quite a shock. You're absolutely right there.
Yeah, and I suppose just again, I've alluded to some of the support services. Jessie is 37, so she's young. She's got young children, and we do have specific information and support for people who are under the age of 45 and under. So we've got information specifically around some of the sort of the specialist needs or sort of things that people might face if they're a younger person going through that. We also have support events. So we've got our Younger Women Together. They're both online and in person. And again, if you go on our website, you'll be able to access that information or give us a call on their helpline and we can talk it through with you. Because we do often hear about people who particularly when they're diagnosed at a younger age, not feeling like there's anyone else in the hospital that's their age. So it can often feel quite isolating.
And just the other thing on that, Lisa, I know you mentioned about Jessie J having children. I'm not sure how old her children are, but obviously there's the Fruit Fly Collective as well that have some fantastic resources around talking to children and managing that side of things. And we've got information in that Younger Women package on the website around, having breast cancer while you are also trying to be a mum.
Yeah, and absolutely. From my understanding, again, from social media, it's her son's I think sort of 2 or 3 possibly. So, and again, it's the Fruit Fly Collective have a huge amount of resource around different ages. And it can sometimes be, how do you get across, particularly for younger children, that you're not able to pick your son or daughter up as you normally would. So again, there is support resources out there for anyone who may have similar age children. So sort of moving on, again, I suppose that's recently been in the press is the Princess of Wales spoke about her cancer diagnosis recently, and Amy Dowden, and they've both spoken very openly about the struggle when you finish treatment. And I think Princess Kate spoke about it being a bit of a roller coaster. And Amy Dowden, again, was on the television last week talking about it was probably the hardest point. She thought actually the treatment was the hardest point, but finishing treatment and adjusting to that new normal was, if that's the term that some people will use, or just adjusting after treatment, is the hardest part. And do you want to talk a bit about that, Cassie?
Yeah, absolutely. And again, I'm sure you'd agree, Louise, this is something that we talk to people about a lot on the helpline and through the Ask NS service. And as you said, with the body image, preparing for how you're going to feel after treatment is something that can be really difficult because nobody knows how they're going to feel. And actually, it can take people by surprise sometimes that actually they come towards the end of treatment and there's sort of a pressure and expectation to feel better. Your treatment's done now, your cancer's gone for people with primary breast cancer. And there's this feeling of, well, I should be back to normal, as you say, or finding my new normal. And actually, that journey of recovery is so different for everybody and can take so much longer than we think it's going to. And, we always say to people, please don't put pressure on yourself or take that pressure on from other people that you should be feeling anything at this point. Take that word should out of your vocabulary because how you feel is how you feel. And it takes as long as it takes. And it's okay to say, actually, do you know what? This is really hard. Particularly as the end of treatment, depending on what treatment somebody's had, they may well still be dealing with side effects. The after effects of surgery, the recovery, as you mentioned earlier, can take quite a long time. Side effects from chemotherapy can be ongoing. And if somebody's having hormone therapies, they're beyond those treatments for 5, maybe 10 years and managing side effects. So those early couple of years after treatment can be difficult. And as you say, it can be difficult to come to terms with that if you haven't been expecting it. On the positive side, though, it does get better over time. It may not feel like it when you're just at the end of treatment, but we say to people, you may not see it now, but for most people, this does get better. It gets easier as time goes on, but you just have to allow yourself that time for healing. But there's also a lot of support out there for people as well. So we have the Moving Forward programme through breast cancer now, which is aimed at people that have finished treatment between sort of 6 months to 2 years ago. And it's all around having those conversations about physical recovery, emotional recovery, managing side effects. There's a nurse Q&A session, and it's all run in small groups with other people at a similar stage in the journey. So you get that fantastic peer-to-peer support with other people who have been there and understand. And that kind of support is absolutely valuable. And just say we think a lot about the physical recovery, but actually we quite often say to people the emotional recovery can take a little bit longer. And again, there is support available for that. If you are somebody who's sitting there thinking, yes, I'm struggling with this, talk to your breast care nurses, talk to your GP, because there's support in terms of CBT, talking therapies, exercise, movement groups, things to help you kind of through that process. The only other thing that I would say as well on that front is we also have our Someone Like Me service that can put you in touch one-to-one with somebody who, again, has been through similar treatments, has been through a similar journey. So if it is helpful for you to talk to somebody who's been there and come out the other side of it and can say, this is how I felt back then and this is how I'm doing now, it's another brilliant service to look up. And I think we'll make sure that all of those services we've mentioned tonight are also linked in the comments below. I don't know if you had anything to add onto that, Louise, before we move on to some of the questions that come in.
Yeah, and I suppose, I mean, we've started the session talking about people in the sort of media spotlight, but I think the flip side to that is try not to compare yourself to others. I think we live in such a world of sort of social media where you see people sort of posting, and you might see people posting that they're struggling, but the flip side is if you see people sort of looking absolutely fabulous, dolled up, like they've got it all together and they're looking amazing, is you can put pressure on yourself as if to say, well, why are they doing so well and I'm not? And that can be really difficult. So I think a really good point is try not to compare yourself to others that you're seeing out there, because again, that can be really difficult when you might be getting out of bed, you're really struggling with some of the side effects of treatment. Emotionally, you are not quite there. You're just having a bad day, and then you're seeing sort of posts. And sometimes I'll say to people we speak to on the helpline, it might be healthy to come off social media for a while. Also, another thing is sometimes when a celebrity might get diagnosed, that can be a trigger for people maybe who are a few years out, and then they get that diagnosis and it just brings them back to the forefront of their diagnosis. So it's just being kind to yourself, really, and just being aware and just, again, I know we've mentioned the helpline, but if you are struggling, if you're not quite sure where to go, we've got a fantastic team of nurses and that have got the time that some of the nurses in practice don't always have. So do give us a ring on the helpline. We can talk it through with you.
And I think that's a really important point, Louise, is around things that can trigger those emotions to come back. Because, we quite often speak to somebody who will say, I was just in a shop and I saw this, or I had to go into the hospital for something else. And memories will suddenly start coming back and trigger those emotions. And that, again, can be quite unexpected for some people. So it's almost about kind of acknowledging that, yes, actually, I might have those moments when things feel harder and everything comes flooding back. I might have moments where actually I'm doing well, and it's okay to enjoy the good moments and to acknowledge sort of the bad days are going to happen. But yeah, anyone that's sort of struggling to get through those bad days, do reach out to the helpline, to your breast care nurses, because there is support out there. And Lou, we have had some questions starting to come through. So actually, we've had 2 questions around the same sort of theme. So I'll put these to you as one question. So we've had a couple of questions around hair loss. So a question for Melanie asking, when during your chemotherapy do you use your hair? Is it at the beginning or further on? Oh, and the other question, sorry, is also for Melanie as well, just asking, is it at the beginning? Is it at further on? And she's asked if Jessie J is having chemo, which is obviously something that we don't know.
Yeah, unless she divulges that, we're not aware of her diagnosis, and so we're aware of her diagnosis, but not what treatment she's having. But certainly with the question around sort of chemotherapy and hair loss, and again, this is a really important question to ask, and lots of people, it's when they're faced with the decision of having chemotherapy, it's one of the most important questions, and it's a worry, because people want to know, am I going to lose my hair with the chemotherapy drugs that I'm being given, and when is that going to happen? So in answer to your question is, for most chemotherapy drugs for breast cancer, they do cause hair loss to sort of varying degrees, and there is something called scalp cooling, which I will come on to talk about in a moment. And we have got further information. We've got a booklet about hair loss and breast cancer, which has got a lot more information in it. But so if you weren't to have scalp cooling, and scalp cooling is a very ice cold cap that you can place on the head, which can reduce the chances of the hair coming out when you're having chemotherapy. If you don't have scalp cooling, usually within a couple of weeks, you'll start to notice some of the hair coming out. And it is varying. Some people will lose that much quicker than others, at a much quicker rate, and others it might be sort of less so. Your treatment team will talk to you about whether or not scalp cooling is available, and it is available in most places in the UK. If you wanted to try scalp cooling, it's not guaranteed that the hair won't come out, because it's not successful for everyone. But if it does work for you, it can either prevent the hair from coming out so that you maintain your hair throughout your chemotherapy cycles, or it may slow it down. So it might be that you have scalp cooling for a certain part of your treatment, but it might thin, and if it gets too thin, it may be that the scalp cooling, you can't continue on with that. But certainly, again, you can speak to us, you can read further information on the website around that. And I often say to people, because it is an ice cold cap, it's very cold, and it can feel quite intense in the beginning part of your treatment, and you have to wear it for sort of slightly before your treatment, for the duration of your chemotherapy, and a period of time afterwards. So for some people it would extend that time, but if again, and for lots of people, keeping their hair is very important for them, then it's worth talking to your treatment team about that being an option for you. Again, there's a really good organisation called Cancer Hair Care that's got lots of information and support around hair loss and scalp cooling. And again, you can either talk to your treatment team about the options for if you were to lose your hair during chemotherapy. So there's wig provision, there's scarves, there's hats and things like that you can have. And again, some people choose, if they're going to start losing their hair during chemotherapy, that they want to just take it off, and they want to have control over that, rather than the sort of seeing the hair coming out in your pillow, in your brush, in the shower. So again, it's such a personal, it's a really difficult thing, because again, for lots of people who don't look ill when they get diagnosed, it can be sort of a real visual thing that you're losing your hair. And it's not just the hair on your head you lose. or you can lose, can be your eyebrows, your eyelashes, all of your body hair. So again, that's something that is difficult. It's a really difficult side effect of treatment.
And I think that's one of the ones
there
that
anything
people think about their hair on the head. I think a lot of people don't necessarily realise that actually you can lose eyebrows, hair under the arms, sort of other body hair as well. So that's a really good point to point out.
Yeah, and I've just remembered, Look Good Feel Better is a really good organisation that we will often signpost to for people that are going through chemotherapy. Again, it's you get a beauty box of products that are that can help when you're not feeling so good, and you can go along and they can give you tips of how to sort of draw on your eyebrows or sort of do your makeup and things like that. And it's just a bit of a treat. It's been going for many years now. Again, I think we've got information on our website, but if you just look up Look Good Feel Better, they've got them across the UK.
Fantastic.
Was that the whole part of that question, Cassie, or was there another part that
Melanie's also asked a question around surgery as well. So as well as asking around chemotherapy, she said she's had a lumpectomy and lymph nodes removed under the arm, and it's very sore and feels like it's stretching. 4 weeks post-surgery, is it normal? Do you want me to take that one?
Yeah, do you want to answer that one, Cassie?
Yeah, sure. Just to say, yes, it's really common a few weeks after surgery to still be having some pain, some swelling, some tightness. You may well have been given some exercises to do by your breast care nurses. It's good to be doing those as regularly as you can to avoid the stiffness, but if you find it's making it more sore, you can cut that back on how often you're doing those. And again, it's something that we would always say, if you're having some pain after surgery and it isn't getting better, do have a chat with your treatment team about it. Give your breast care nurse a call, because they can always get you into the clinic to have a look at it, make sure everything's healing okay for you. But at 4 weeks after surgery, particularly as you mentioned, having lymph nodes removed, it is really common to have still some soreness at that point. There's a lot of nerve endings under the arm. It can be a very sensitive area, and people can find that kind of nervy type pain can take sort of several weeks, sometimes several months to go away altogether. So I would say, keep an eye on it. It is quite normal, but if it is bothering you, if it's getting worse, if it's not getting better, then do talk to your treatment teams about it.
Yeah. And she mentioned something about stretching, and I'm just wondering, and again, it's really difficult for us to say just on a question, but sometimes people after surgery can get something called cording. Yeah, where it's sort of that it fibroses, and it can sometimes feel like a bit of a piece of string, can't it, sort of underneath your armpit. And if you do that there's not quite enough stretch in your arm, or something's going to sort of ping like a piece of string. Again, we can't say from your question whether or not that is that. We have information on our website, but certainly it's about, as you said, Cassie, going back to your treatment team, they can have a look at it for you. And cording is again, it's something that commonly happens after breast surgery, and you can do things about it. It's not something that remains. So,
and the treatment team may well be able to refer on to somebody like a physiotherapist for support with that if it is something like cording. So there's definitely support out there.
Yeah. And this is, I've jumped probably ahead. There's a few questions, but Angelina's asking about vitamins and supplements. What vitamins and supplements are safe to take with hormone positive breast cancer? And we often get asked about vitamins and supplements, don't we, Cassie?
Absolutely. Yeah, that's a really common question again. And the answer is generally we can't say. So, there are lots of different herbs and supplements, and some can interact with other medications and some don't. So it's really difficult to be able to say what's safe and what isn't. There is a fantastic website called MSK, so the Memorial Sloan Kettering Hospital, which have a herbs and supplements database. So you can go on there and look at individual herbs and supplements, and it will give you sort of an idea of what they're used for, whether there's areas where they can't be used, so contraindications, things they might interact with. So that can give you a bit of an idea. But really it is around, again, talking to your breast care nurse, your treatment team, or an oncology pharmacist. Pharmacists are a fantastic resource that are quite often underutilised. We don't think about going to a pharmacist, but they would be really good to be able to say, this is what I want to take, this is the medication I'm on, are there any interactions? The other really good resource that's fairly new is the World Cancer Research Fund Nutrition Helpline. So they run a free helpline that is staffed by oncology dietitians. So if you have sort of questions around vitamin supplements and you can't get to speak to a dietitian, or you are struggling to get advice through your teams, they're another resource where, again, they would probably be saying, we don't have the evidence to know for sure, but this is what we can tell you. So they're another really good avenue. The main vitamin and supplement that we know is okay are things like calcium and vitamin D. They're quite often given alongside hormone therapies. Vitamin D, most people in the UK are encouraged to take. So there are exceptions to rules. So there are some things that we do know are okay, but it's always the right thing to run it past your team, because they have your full medical history and they would be able to answer based on your individual situation. Is there anything you'd add to that, Lou?
Yeah, I suppose, I mean, Angelina said that she's ER positive, and I think what we worry about is the interactions, as you've said, Cassie, with treatment. So if you're on hormone treatments, sometimes they can change the effectiveness of that drug. And the other thing, I suppose, with the supplements, herbs and supplements, is they're not, they don't go through the same sort of rigorous testing process. So what may be a particular supplement in a particular shop or online may be very different. We don't know, although it will have the sort of the strength of it, we just don't know all the components that are made up with that. So it's not the sort of same standard rigorous testing that drugs coming through sort of that you're given through pharmacists. They don't have that sort of same standard and rigorous testing and studies, big clinical studies on them. So it's it's a really tricky one, because people want to take them to sort of manage maybe side effects they're getting, or take some control, or be healthy. It's just knowing that what to take, but often it's about sort of a balanced diet, isn't it? You get, if you've got a good healthy balanced diet, you'll get what you need from that.
And I was just going to give a plug there, Lou, for our diet information that we've got on the Breast Cancer Now website. We've created some videos, and one of the things that Rachel White, the dietitian, talks about in the videos is sort of supplements and how actually we can get a lot of the nutrients through a healthy, balanced diet. And there's some information and some links on there around how to manage to do that, because it can be really difficult, particularly if you're suffering with side effects from treatments and recovery, to get that kind of healthy, balanced diet. But again, there's support out there, so it's worth having a look at the information on our website. Joanna here has asked a question around radiotherapy. I don't know if you want to take this one, Louise. So finished radiotherapy 5 months ago, but lately having problems with itching, redness of the skin, and hot to touch on the breast. Could it be after effects of treatment still? Again, a very common question.
Yeah, it is, isn't it? And it's a difficult one. And we would always say, I mean, we know that in those early sort of weeks and months that can be, you can get skin reactions after radiotherapy. But 5 months down the line, if it's hot to touch and red, I would definitely say go back to your treatment team and get it checked out, because if there is an underlying infection there that's causing those symptoms, if they've just happened, something needs to be sort of checked out, really. So would you say the same, Cassie, about going back to your treatment team?
Yeah, absolutely. Anything like that, particularly, it's the things about sort of the redness and the heat, definitely. That's one to go and talk to your teams about. And it may well be related to the radiotherapy. It is possible to have late skin effects, but it's important to rule out, as you say, things like skin infections, which again can happen several months after surgery. So definitely one for the team there.
And I suppose, again, you mentioned about the Q&A at the moving forwards, and I'm often, when we do those Q&As, giving people permission to go back to their teams. We know that treatment teams, both me and Cassie have worked in the NHS for many years. We don't anymore, but know how busy treatment teams can be. And I think lots of people, after they've finished treatment, sort of feel that they don't want to bother their team because they're busy and they know that they've sort of got lots on and they're treating people that are actively having treatment. You are justified and just as worthy as those people going through treatment to contact your team. I would always say, when I worked as a breast care nurse, I'd much rather you contact me and we get it checked out rather than you sitting at home worrying about it. So absolutely giving you permission to contact your treatment team. And if you struggle or you hit any walls, ring us on the helpline and we can talk it through with you.
100%.
I'm just looking at what other questions. Yeah. So Jenna has asked, and I actually don't know the answer to this, and I wonder whether we can probably get back to Jenna, unless you know the answer to this, Cassie, is how far in advance should you stop taking bisphosphonates before planning a pregnancy? I've been advised about hormone tablets 3 to 6 months, but there isn't much often said about bisphosphonates and impact on the baby.
Yeah, no, that's not one that I've come across before.
No. So I would probably say give us a ring on our helpline if you want to. If not, we can answer this question and post it tomorrow once we've had a chance to look, because I don't want to sort of give you the wrong information. And that's the fun part of this job, is we often get questions asked that we've not been asked before. So
and this is what we're saying about the value of a multidisciplinary team. You know, if we don't know the answer, we have people we can go to find out. So Jenna, I would say, either give the helpline a call or keep an eye on the comments, and we'll try and get an answer and post it in the comments for you.
Yeah, and depending where you've had your treatment, Jenna, as well, some of the bigger hospitals, their pharmacist has medicines information lines. And again, as you said, pharmacists are brilliant. They are the people that know that information inside out. And I know where I used to work in London, there was a medicines information line where patients could contact with any questions around different medications. So again, I mean, although we'll answer, but if you wanted to go to your hospital and ask the pharmacy there, they should be able to get back to you with that answer as well. And understandably, you want to be safe if that's what you're planning on a pregnancy. You obviously want to make sure that there's a safe amount of time that you're off that drug.
Yeah, absolutely. Yeah. And Lou, I've just spotted a question here that I think it's a good one for us to answer live from Jeanette, who says she's got breast cancer again after 10 years. It's come back in the skin, where she had a skin-sparing mastectomy. She's had chemo again, radiotherapy, Vesgo, and she's very scared after treatment that she's just going to be left and not monitored. And just to say, Jeanette, this is a kind of question, again, we get really, really commonly on our helpline. And I would really urge you to give your breast care nurse a call and talk through how you're feeling with them. They will be able to go through with you what sort of ongoing treatment or follow-up is at your hospital. And, you know, no one would ever sort of just be left. There would always be some sort of follow-up in terms of you will always have somebody to contact with questions and concerns. That's exactly what your breast care nurses and their teams are for. But it sounds like you might be struggling. And I would say to you, if you are feeling low, if you are feeling like you're struggling at the moment, please do reach out, give our helpline a call so we can talk through this with you in more detail. Or, you know, tomorrow reach out to your breast care nurses and say, this is what I'm worried about. Can you just talk me through how this works individually sort of for the hospital where you're at, because it can be different. So it's difficult sort of for us to say, well, this is how you would be followed up. But they will be able to sort of talk you through that process. Lou, I just wondered whether you had anything you wanted to add on there.
Yeah, no, I think everything you said is really important, Cassie. And our booklet, After Breast Cancer Treatment, What Now, talks a bit through about the follow-up process, because it really differs from hospital to hospital and the individual person and how they're followed up. So certainly it's about knowing who to contact for what. So as you've said, Cassie, get in contact with your breast care nurses or give us a call and we can talk through it in a bit more detail with you. But yeah, I think the difficulty is fear of recurrence is after every diagnosis is what a lot of people struggle with and adjust to. And obviously you were 10 years down the line and you got your breast cancer came back again. And I think when that happens again, that sort of that fear has lived out. So it's that emotional impact of it's happened once, can it happen again? And again, your treatment team will be able to talk to you about prognosis and all of the individual features of your particular breast cancer. But understandably, the emotional impact and the fear, having had it once, and I know when I've looked after people, and we speak to lots of ladies on the helpline, when it comes back, it's the what do I do now, and how do I deal with that if it's come back once? So it's I can understand it. It's probably a really difficult time for you, and we are here if you want to talk, because obviously the helpline's not open till the morning, but if you wanted to leave a message on the answer phone, and we can get back to you and give you a call in the morning.
Absolutely, please do. Right, let's have a look down, see if we've got any more questions here that we haven't answered. Do bear with us while we try and scroll through them.
Oh, so Eleanor's asked, I have I think she said she's 36, have an invasive ductal cancer grade 3, PR positive, HER2 negative. I had surgery on the 19th of July, so gosh, last week, and I don't know what to expect next after the surgery. So I don't know if Eleanor's asking what treatments she's expecting, which again can be really difficult for us to answer because we also don't know what surgery you've had, Eleanor. But if you did want to, again, as we've said to others, give us a call. We can talk through the possible options that you may have. Often it is, Eleanor's finding out, obviously you're recovering, and what I'll often say to people is it can feel quite overwhelming to sort of still be recovering from surgery and then be thinking what's next, and you may have been told when you're coming back for your results, and that's at the point where they will make a decision about what comes next in your treatment and what is involved. I presume because you're ER positive that one component of your treatment will be hormone therapy, which is a tablet, but other treatments such as radiotherapy or chemotherapy really will be individually based on sort of what the surgery has found. Is there anything else from that, Cassie, you would suggest?
Yeah, no, I think you've covered it really well there, Lou. And as you say, if you want to talk through it on a more individual basis, do give us a call and we can talk through that with you. But yeah, like you say, it can be a really difficult time, can't it, after surgery? Because from diagnosis to the point of having surgery, if surgery is your first treatment, everything kind of sort of snowballs and it's all very, very quick and lots of dates and lots of planning. And then suddenly you're at home and you're recovering and it gives your mind time to start thinking. And that question of, well, what's next? What coming next? Does often start playing at that point. So I think, yeah, it's really understandable that you're starting to think about and worry about what comes next. And just as Lou said, reach out to your team or reach out to us to talk through it. And hopefully we can help.
Yeah, and you said, I think from the message it says you're 36 as well, and I mentioned that right at the very beginning. We do have services particular for younger women, and our Someone Like Me service, we have volunteers who are younger as well. So if you did want to speak to somebody of a similar age who has been through treatment, again, sometimes it might be about once you've got those results and you know what your treatment plan is. But even if you want to speak to somebody while you're recovering from surgery, again, we can. If you go on the website Someone Like Me service, you can be matched with a volunteer who can speak to you as well, because sometimes, again, lots of younger people say to us that they can feel quite alone because there's less people of their age in the hospital.
And Lou, I think we've got just one more question here that I can see that we've not answered. And then I know you wanted to talk a little bit about signs and symptoms. So we've got a question here from Katie saying that she's had triple negative breast cancer and it didn't show up on a mammogram. And she's saying when she starts her yearly checks on follow-up, she's worried that a mammogram won't pick up any cancer. And will I be offered an ultrasound or an MRI scan instead? And again, this is a question that we get asked a lot at our moving forward Q&As. And at the moment, mammogram is still the standard for follow-up. And they do say that MRI can be considered on an individual basis for some people if there's a rationale for it. So if it's something that you're worried about, then do talk to your team and say, this is my concern. Will I be having a mammogram or should I be having something else? An ultrasound wouldn't normally be offered instead of a mammogram because ultrasounds are really good at looking at one focused area. If you know you've got something to look at, you can focus in with the ultrasound, but they're not very good at giving a general assessment of the overall breast. So an ultrasound is normally an addition rather than an instead of. And I know I've heard our surgeons say sort of to lots of people in the clinics that even though one cancer wasn't picked up by a mammogram, it doesn't mean that something else wouldn't be, particularly when they're reading sort of follow-up mammograms. They're doing it with the knowledge of the cancer diagnosis that you've had. So it's read with that context. But it is a really difficult one and it does cause a lot of anxiety for people. And we would always, again, direct you back to your treatment teams to have that discussion because, treatment plans are individual and for some people an MRI might be indicated as being useful for follow-up. And obviously it's something, again, we've seen going right back to the beginning in the press, in the news with different studies, that actually it's something that is constantly being looked at. Are we still doing the right thing? Are there going to be changes in the future? At the moment, the advice is still mammograms are our best way of doing follow-up. Is there anything that you'd add to that, Lou, before we move on?
Yeah, and I just suppose it's just about being breast aware, which again comes up a lot at our moving forward courses, isn't it? How do I know to check? And I've had surgery and my breast feels so different. It feels lumpy and bumpy. And how do I know if that's just a post-surgery lump or bump, or is it? And again, it's not, there's not an easy answer to that, but it's just getting confident with feeling that breast. Depending on the surgery you've had, radiotherapy can cause it to feel different as well. And if you're not sure, if something feels that it's different, or you've got a lump or a bump and you're not sure about it, is getting it checked out. And again, not feeling like you are bothering people. Treatment teams will understand the level of anxiety that you're going through in that immediate. And in those years that follow, if you're not sure, we would always say, get it checked out. And I always used to say, again, when I was in practice, much rather you ring, we get you in, get you assessed and say it's fine, rather than you worrying.
Yeah. And we pick up a lot of things, don't we, in that follow-up period that aren't a new breast cancer, things like fat necrosis, which can be little areas of fat that have died off in the breast that feel like a very solid lump, scar tissue. So never be afraid to go and get it checked out, because once you know what your feeling is, it gives you that reassurance to know when something's different, and again, sort of get things checked out. And that does bring us quite nicely, Lou, onto breast awareness and breast check-in. So I know you were saying it's come up in conversation recently around how, changes don't always present as a lump, and you wanted to talk a little bit through that.
Yeah, I think it was just at one of our support events, somebody was just saying, I just assumed it would be a lump, and actually I think what they were diagnosed with didn't present as a lump. So it really was just sort of finishing off with, and then again, I'm sure people watching will have had different sort of signs or symptoms that led to their diagnosis. So I think commonly we think of breast cancer that people will feel a lump, and that's what takes them to their GP. Again, we do know for some women it's picked up on a mammogram. They don't feel anything. It's just detected on their screening mammogram. But I think it was just really, I thought it was important just to highlight some of the signs and symptoms of breast cancer, or things for anyone who may not have a diagnosis of breast cancer that might be watching, of just being sort of breast aware. And we just really encourage everyone to get confident in checking, and there's no right or wrong way to do it. It's just about regularly checking your breast, getting to know what your normal is. But if you notice a change, having the confidence to go to your GP and get that checked out. And we know, as you said before, most things don't turn out to be, even if you've had a breast cancer, changes. But for people that haven't had a diagnosis, most changes won't be breast cancer. But things really to be important to look out for is might be a change of the skin, so a different change in the colour, a change in the nipple, so a nipple discharge, maybe the nipple wasn't inverted but becomes inverted, a rash or crusting around the nipple, changes in the size or shape of the breast, a thickening, and again, it's when we talk about checking the breast, it's going right up to the collarbone and right into the armpit. And if you notice any changes, and again, it's about, again, we say touch, look, check. So you're touching the area, you're looking in the mirror, you're looking at both breasts, and if you'll find a change, going to get it checked out. We've got all the information around this on our website. Pain comes up a lot, and usually on its own, pain is not associated or a sign or symptom of breast cancer when it's on its own.
Brilliant. And as you say, there's a lot of information around that on our website. We've got the really lovely TLC infographics, so sort of pictorial representations, and that again is tailored to show signs and symptoms on different skin tones, on different people. So really, go and have a look on the website if you're interested in sort of learning a little more about the signs and symptoms to look out for. And I think we're just coming up to 45 minutes, so this is us coming towards the end. So Lou, just before I close things for today, we are having a slight break probably from the Facebook Lives over summer, but actually we've got some speakers' lives happening. So we thought instead of promoting the next session, we would let you know about some of our speakers' lives that will be coming up. So would you like to give some details around that, Lou?
Yeah, so for those of you who might not be aware, we offer speakers lives, a bit like a webinar. You have to register for them, and you can go on our website. If you put speakers lives, you'll see the ones that are coming up. But we've got one in August, which is around sleep, and we know that through treatment, through the emotional impact, lots of people can have their sleep impacted. And this speaker has spoken before, really good session. It's on the 19th of August. So if you did want to listen to that, You can go on the website and book on to listen and watch live. You can post questions. Again, it's anonymous. Nobody's sort of on the camera, so you can be sat on the sofa and have it, and then post your question, and the speaker will answer those. We have got other ones coming up in early September. We've got one on breast reconstruction coming up, and again later on in September, one about sort of understanding menopausal symptoms and hormonal therapies, and managing hormonal therapies. So and I think there is one on bras and prosthesis as well in September. So but again, helpline continues on. Yeah, helpline continues throughout. As always, we're not breaking for summer with that. So do get in contact with us if you've got any questions.
Perfect. And I think that's us finished for tonight. So as Lewis said, the helpline will be open again tomorrow from 9 a.m. till 4. So that's every weekday, 9 to 4. On Saturdays, 9 to 1. So, if you're listening and you've got questions that you didn't feel comfortable to ask, or you'd like to talk through one-on-one, concerns that you want to talk through, please do. Just pick up the phone and give us a call. It's what the helpline's there for. And you can also use our Ask Our Nurse service to write your questions if you're not comfortable on the telephone. And we will have all the details of that in the comments below. You're also going to see in the comments that there is a survey. So we really, really appreciate your feedback on these sessions. So if you could take just 2 minutes to fill in that survey to let us know how you find the sessions, if there's any particular topics you'd like us to cover, we value all that feedback. So if you do have a couple of minutes just to let us know what you think, we'd really, really appreciate that. As I said before, I think we've got through most of the questions that have come in tonight, but if any questions come in afterwards or there's things we haven't managed to answer, we'll try and write replies to those. And as we said, Jenna, your question about the bisphosphonates and pregnancy, we'll try and get an answer to you in the comments as well. So that just leaves some thanks. So thank you, Lou, for joining me tonight, and thank you to everybody watching. Also, massive thanks to Kev, who's beavering away behind the scenes there, getting your questions to us and producing this live tonight. So we wouldn't be here without that support. So thank you to Kev and to all of you for watching. We hope you have a lovely evening. Hopefully it's not raining where you are as it is here. And yeah, have a lovely evening, everybody.
Thanks, everyone. Good night.